Hi everyone, I'm Justin.
Hi, my name's Melissa.
And I'm Lauryn, and this is our final movement assessment video. For clinical history, I sprained my right wrist twice in 2014 and 2018. I sprained my right ankle 3 times and once on the left between 2014 and 2019. I had right upper trap pain in 2018, and I had a possible right knee meniscus tear in 2014 to present. I grew up in a very active family, so I played a lot of sports growing up, mostly basketball from 2007 to 2019, and I swam competitively in high school in 2016 and 2020. For physical activity, I'm currently inactive, but I swim leisurely. I only do activities of daily living like basic chores and driving. I'm a stomach sleeper, and I do 5.5 hours of class a week and 16.5 hours a week lifeguarding.
So following the 4-week training program, we conducted a post-training FMS assessment on Lauryn. From that, we found notable changes in 3 specific movements. First movement being the steep squat, second movement being the hurdle step, and lastly the third movement being rotary stability. Starting with the initial FMS assessment on the deep squat movement, Lauryn had a final score of 2, which indicates that she had her heels elevated during the movement since the deep squat was not completed with the perfect form and the score attempt for a perfect 3. The only major compensation still seen with the heels elevated deep squat was that the dowel was being uneven when viewing Lauryn from the frontal plane, specifically favoring her right side. From this, the main issues concluded was that Lauryn had core instability and lack of ankle dorsiflexion mobility. To combat these issues, we put together a set of corrective exercises that would aid Lauryn in these areas. First, we did a core bracing exercise. To help with core instability, we, in our case, chose the plowing the field exercise, in which we started with 3 sets of 5 repetitions on each side and progressed it by increasing the number of repetitions weekly until finalizing with a 3 sets of 12 repetitions on each leg on week 4. Secondly, we did a ankle dorsiflexion mobility type exercise where we had we did heel unsupported mini squats to aid in her lack of mobility in the ankle, in which Lauryn started with 3 sets of 10 repetitions, and for progressions, we increased the amount of repetitions as well as alternating leg stance weekly, so transitioning from regular stance to single leg stance, as well as increasing the sets by finalizing it to 3 sets of 20 repetitions by week 4. Lastly, we did a glute activation exercise, which are glute bridges. For this, we did we did 3 sets of 10-second holds for progression, which we increased the amount of seconds for the holds until finalizing with 3 sets of 90-second holds on week 4. After concluding with the 4-week training program, as mentioned before, we reassessed Lauryn, and for her deep squat move FMS assessment, although she finished with a final score of 2, which was the same as the initial assessment, Lauryn still had significantly better movement pattern. For example, the main difference we saw was that the dowel is not uneven during the movement on the post assessment when viewing it from the frontal plane, so there isn't any leaning on the left now, indicating better core stability as well as progression in this case. Now, in regards to the lack of ankle dorsiflexion mobility for Lauryn, there was no progression seen in this, indicating either incorrect exercise choice or lack of progression, or simply needing more time in her training period.
Next was the hurdle step. So for her initial assessment, Lauryn did receive a score of 2. This was for both right and left legs. We noticed that there were similar compensations for both the right and left legs, which were spinal rotation to either the right or left side respectively, some lumbar extension, a hip hike, ankle inversion, and abduction of the moving leg. We concluded from this pre-assessment that the main issue was core stability. Regarding the corrective exercise training for the hurdle step, the first exercise that we did was plowing the field. The purpose of this was to work on bracing the core while moving distal limbs to maintain an upright trunk and to improve core stability for the post-training FMS assessment. During week 1, we started with 3 sets of 5 reps on each side, keeping the dowel pinned to her hips while maintaining straight legs during the movement. Over the course of the 4-week progression, she finished at week 4 with doing 3 sets of 12 reps on each side with the resistance band that had greater tension. So overall, her progression included increasing number of reps and using a resistance band with greater tension while holding the dowel toward her. Regarding the glute bridge holds with the resistance band around her knees, the purpose of doing this for the hurdle step was that glute activation is just important overall for her movements. This is an area of improvement for those in Western American cultures. And also, given her cessation of exercise prior to the training program, we decided this would be important to implement to see how this could improve her FMS scores. For week 1, we started with 3 sets of 10-second holds, but we quickly realized that this was not challenging enough and she needed to rapidly progress to be a little bit more challenging. From week 1 to week 4, we saw a progression of 3 sets of 90-second holds for her glute bridge with resistance bands.
For the final assessment post-training for the hurdle step, we decided to
gave her a score of 3. We noticed that there was major improvements on both right and left legs, and we only noticed some minor ankle inversion for both sides. For conclusion, we saw an overall improvement in this FMS movement from pre to post.
Now looking at rotary stability from the initial assessment, I scored a 2 since I was unable to complete the movement ipsilaterally. In the contralateral movement, I had slight lumbar flexion and extension. We concluded that the main issue for this was poor core stability. To target the poor core stability, I first had to do shoulder taps. Initially, I started with 3 sets of 5 reps on each side and had to regress the movement by narrowing my hands until they touched and widening my feet as much as possible while still maintaining a neutral spinal position. We steadily progressed by widening my hands and narrowing my feet and increasing the number of reps. By the end of the training program, I was able to complete 3 sets of 12 reps on each side with my hands shoulder width apart and my feet slightly farther than shoulder width. Second, I did the chop and lift exercise. I started with 3 sets of 10 reps at 10 pounds on each side. I was able to immediately progress and do the movement in an inline position. We progressed steadily throughout the program by increasing the weight. By the end of the training, I was able to complete 3 sets of 10 reps at 30 pounds. Balance in the inline position greatly improved throughout the program. In addition to addressing the poor core stability, we also did the chop and lift exercise for core bracing and glute bridges for glute activation to improve my overall rotary stability. Finally, looking at the post-training FMS, I scored a 2, same as the initial FMS. I was unable to perform the movement ipsilaterally, failing the attempt at a 3. However, my attempt at it was much better than before, and could extend my arm and leg out, but was unable to touch my elbow to the knee. During the attempt for a score of 2, we didn't note any compensations. Both the shoulder taps and chop and lift improved my rotary stability and core stability to improve my rotary stability assessment. Despite scoring the same, we saw an improvement in rotary balance and the elimination of the lumbar flexion extension from the initial FMS.
Regarding some things that we could do differently for something like this in the future, we would definitely consider purchasing or bringing our own equipment. Things like that would be like buying our own resistance bands to make sure we wouldn't have to borrow them from anybody else and to ensure that we have the same resistance bands throughout the duration of the program. Also buying our own PVC pipe so that way we can use that for the different exercise trainings and corrective exercises that we did. Lastly, given that we would have enough money to purchase one of these, we would like to have our own FMS as we did borrow one for the initial pre-screening. Also, we would consider having more days for her training program. Due to limited availability between the 3 of us, we could only stick to 2 days for this 4-week training program. However, in the future, we would like to do a minimum of 3 days per week. And also, we'd like to split up the exercises to those different days of the week with the different movement categories and improvements among those 3 days. And lastly, we'd like to add some additional different corrective exercises and find some on our own, not just Dr. Lynn's corrective ones, although those are great and we did see improvements with those. And this would just help to increase our variability throughout our training program.